Preventing diabetic complications, particularly the eyes, the feet, and the skin, it is very important. You should know that diabetes destroys all the blood vessels in your body. Another area that is very important as part of the diabetic care is high blood pressure. Diabetes is always or almost always associated with high blood pressure, and they are working together in terms of destroying blood vessels. There are various forms of trying to treat or to prevent blood pressure, and that it will be through lifestyle changes and using medications. One, lose weight. If you lose weight by following dietary advice and increasing the exercises, your activity level, the blood pressure will come down. Number two is salt. We tend to use a lot of salt, but the more salt you take in, that will push up your blood pressure. If you reduce the salt or stop it, your blood pressure will come down. Failure of these management or treatment to reduce your blood pressure, you will need to be on medications.
To reduce complications of diabetes, it's important you understand the HbA1c test, which your GP will do or your healthcare professional will do every 3 to 6 months. And basically what this test is doing, this is the HbA1c test. If you want to look at a picture of it, it's measuring how much glucose, which is the white bits, sticking to your red blood cell. So basically this test is giving us a picture over the last 3 months, how much sugar there's been floating around in your body. So someone who hasn't got diabetes, it will look like this, and their number would be somewhere around here. People who have diabetes, their sugar level is running, say, 12, 15, 16, theirs will look like this, and their number will be much higher, somewhere around here. There is one of the largest studies done in the UK called the UKPDS. They followed 5,000 people all over UK for 20 years, and they did this HbA1c test on them every 3 to 6 months. So at the end of 20 years, when they analyzed it, they found out that people who keep the HbA1c test on the target around risk range don't tend to develop complications, and the higher they are on this scale here, you will see then people are much higher risk of developing complications. And also they found that if you went home today and you start working on your HbA1c, keeping your blood sugar level between 4, 5, 6, 7, and 8 before your meals, and you lower your HbA1c, say from here to here, say 1 square, 11 millimole per mole, or 1% on this side. If you do that, you reduce all those complications by 35%. Now, this is true. We see that in clinic every day. So if you lower your HbA1c by just 1%, you reduce eye damage by 69%, kidney damage 34%, nerve damage 69%, having a stroke 12%, and having a heart attack, you reduce the risk by 14%. So to reduce the complications of diabetes, keeping to your diet, exercise, keeping your weight down, and monitoring your blood sugar level, keeping your blood sugar level between 4, 5, 6, 7, and 8 before your meals will help lower your HbA1c near target and ultimately reduce complications of diabetes.